Hi.
Hi.
All right, so just introduction quickly. Who are you, how you found your way into the EP lab? Because I know you because I've known you for a long time, but you have to assume people watching this might not even know what EP is. Some people that work in Cath don't even know what EP is if they've never seen or heard it before. A little background on kind of where you started in healthcare to where you are now. Which is you've pretty much done everything.
That's a very long journey.
Yeah.
Okay.
Walk us through it. What's
Shawna
your name?
Defriece.
Thank you.
Shawna Defriece. And I started as a respiratory therapist and quickly said, this is not what I want to do until I retire. So I started Googling at that time, what can I do as a respiratory therapist that's not respiratory therapy, but not have to go back to school? And what came up was cardiac electrophysiology.
Wow. I mean, that's a very good
Very
Google
specific.
Search. Yeah.
But that's what came up because there was a local job where I was in the city I was working in, and that is what populated. So yes, you can still do Cath Lab too. That's not what came up. I knew of Cath Lab. I had never heard of EP Lab. I had taken many patients with transport to CT, MRI, Cath Lab, and all the things. So I knew of Cath, but I did not know what EP was. So my next Google, and mind you, I'm working night shift on the clock while I'm doing this because I literally hated what I was doing. And I was like, what is cardiac electrophysiology? I was blown away. I got a lot of neurophysiology. I got a lot, but even though it was cardiac, I got a whole plethora of, and I'm like, okay, basically there's electrophysiology and a lot of things. So I was able to narrow it down, so I figured it out. Applied for that job. It was just down the street from where I was working at the other hospital. And I got an interview, and I thought, oh, I need to research because I cannot go in here and look like I have zero clue, because that's not my style.
Even though 90% of people don't have a clue, but yeah, you want to be prepared.
I mean, as a medical professional that was working in a hospital, I didn't know that EP Lab even existed. Like I said, I knew about Cath, but I didn't know. And because that's my personality, I'm not going to go into anything and look like I don't have a clue.
Yeah.
So I did some research. I found it to be pretty intriguing, and I went to the interview, and they asked, the normal, typical interview questions. They showed me around. Then they said, we're going to have you meet with our primary EP. And I thought, oh, okay. I was used to working with pulmonologists, so I wasn't, kind of taken back by that, but I just thought that's strange that they want me to meet the primary EP. His question to me was, why do you think you want to do this and that you can do this? And so I thought, okay, well, he's very direct, but that's okay because so am I. Yeah. So I just looked at him straight in the face and I said, because I'm up for a challenge. And he said, okay. Got home, I got the call that they wanted to offer me the job. He said yes. And basically he was the one that was going to decide.
Yes.
Yeah. And so I think it was that. I think he was looking for somebody that had, even though I didn't know anything about EP, I was confident that I was ready to move out of where I was, and I was hungry to learn something else because I was so already burnt out and bored.
Yeah.
And I'm not knocking respiratory therapists. I mean, my husband was one for also 10 or 12 years as well. Not knocking that. That's how I got my start. That was my stepping stone. It doesn't have to be for everybody, but for me, I just knew I didn't want to do that forever, and I needed to be more challenged.
It depends on the environment and the hospital you're working in, the type of patients that you deal with, if you feel stimulated or not, and how involved people get you into the actual overall patient care versus just come and do your thing and leave, and it kind of gets monotonous.
And it was even more so because it was night shift.
Oh, yeah.
It was killing me mentally. It was physically hard for me. And I struggled. And where I was, Respiratory is very different than if you're used to Cath Lab and you're used to EP Lab. We don't start in respiratory on day shift weekdays.
Yeah, I was going to ask, did you ever do day shift?
No. You have to pay your dues, go through the trenches, 365 day a year job, 7 days a week. It's holidays, it's every other weekend. There's none of that. So the average age and number of people in the facility that I was working in, which was a large hospital, was an 8-year wait. And going to daytime, full day shift, full time rather, I thought, I can't do this.
Yeah.
I can't do this for 8 years. And it sounds horrible, but basically nobody left full-time day shifts. They either had to die, which is terrible, or retire.
Yeah.
And it's
Great staff attrition, but horrible for people who
yes.
are trying to change their circumstance.
Yes, and I thought, it's solely by seniority. It's just the average time. It could have taken longer, but the bottom line is I'm not staying here to find out.
Yeah.
So I have no idea what it would have ended up being, but I just knew that it was time for me to move forward.
Yeah. A lot of people have questions and comments of when they're thinking of changing their career, of a lot of night shift people or a lot of people who are just overworked. And that might have been part of the physician's question, is people come here for a change thinking it's something easier and trying to rule that out of, do you realize like my expectation of you, how involved you are in these cases? It's not just, it can be a clock in, clock out once you're very good, but until you really understand what's going on, like you're going to constantly kind of feel like you're drowning a little bit. And I'm sure he didn't want to invest in somebody if it really wasn't for them, and have the opportunity to say, you know what, I hear you, I want you to change your circumstance, but this isn't the path. Doesn't mean you can't leave and go do something else. It's just not going to be here.
Even though I went through that, I had no idea what I was getting myself into.
I'm up for a challenge, I think.
I was definitely up for a challenge, and I was hungry, and I knew that because of my personality as well, which there was no going back.
Yeah.
I wasn't going back to respiratory. There is no plan B.
Yeah.
I will make this work, and that's why I dug in my heels. But yeah, I had no idea how much of a challenge. I ended up eating those words, but I ended up thriving.
Yeah. Well, did you get what you want stimulated wise? Because the thing with respiratory, besides the night shift, is it was monotonous and you didn't really feel like you were stimulated or challenged or growing professionally. So did you feel like you got that out of VP?
I definitely got that out of VP. How many blood gases can you do? And night shift, we did them all. Them in the lab every time we had a code, and I hadn't done them in years, and I got every single one of them.
PTSD blood gases.
How many blood gases do I have to do before, thousands upon thousands? How many breathing treatments can you give? Like I had only been out 3 years. And I had done everything I could do in my career unless I had gone into pediatrics, which was definitely a no-go for me. But how many terminal weans can you do? How many people's life support can you turn off? How many treatments can you do? How many intubations? How many codes have you ran? There's nothing, even today, other than a few ventilator modes. Field really hasn't changed. And I cannot fathom.
Did you ever manage balloon pumps? Or no?
Learned balloon pumps, we learned hemodynamics, and we learned 12 lead EKG all in respiratory in our program. In the state of Tennessee, where I was, regionally, some regions of Tennessee would manage balloon pumps and place art lines and do the hemodynamics and all of that, and other places didn't. So it depended on where you worked.
Yeah. Usually the respiratory therapists I've met who get interest in the Cath Lab, that's where it came from. They come to manage the balloon pump. And they say, oh, this is cool. How'd you get here? I'm like, you can literally work here if you want to. You have to learn everything, but you can work here.
Which brings me to the next thing. In Tennessee, there are no CVT schools.
Yeah.
So everybody who went to work in EP Lab or Cath was all on the job trained.
Yeah.
They were all nurses, rad techs, respiratory therapists. That's what we did.
Someone willing to be uncomfortable.
Somebody willing to learn something, and that's just how it was. It wasn't until I moved to Florida when I started working, and I'm like, why are there all these, what are you? CVT, what are you? A CVT, what are you? A CVT? I'm like, what is this?
Yeah.
And why are there so many of
do you
you?
learn?
And what is that? But I did know, because we ended up eventually in Tennessee at my hospital getting one CVT, and everybody in Cath and EP, because I was dedicated EP lab. So we had a Cath lab, had 2 rooms for Cath and 2 for EP. And we ended up getting a CVT, and everybody was just like, where'd she come from? What is this? What do they do? It was so foreign to us, but she was excellent. And everybody's like, we need more of her. It was great. And so when I moved here and I found out how many schools there were, and then I started working as students came through in clinical, and then when I later went into leadership, started hiring them as interns and hiring them as employees, I was like, this is the best thing ever.
Because you know what it's like to not have any of that.
Yeah, I did it all the hard way.
Yeah.
I learned by trial and error and fire. And it was difficult. And so they really bring a lot to the field, and so many people don't know anything about them.
Yeah. No, it's true. And even within our own state, there are hospitals that still ask that only have nurses or only have rad techs. And if you've never worked somewhere else or had that oddball come in with a different background, or even as a traveler with a different background, you really don't know the options. And sometimes even as a respiratory therapist, as rad tech, you don't realize that you can have that opportunity also. If you've never heard of it, never met somebody who's done it, or the lab in your state doesn't allow it, but you really want to do it and you can move, go somewhere else that lets you, if that's really what you want to do. Some people are limited by state and region, but that doesn't mean, unless your life is there, that you can't seek opportunity elsewhere if you do want to learn it. Somebody somewhere doesn't have an option and will use you and train you. For those who don't know, in case someone in high school or a new college student watches this, describe it in the way that would have made sense to you at the time. What is the EP lab and how do I get in?
I'll tell you what I was told when I entered into the EP lab. Basically, no one knows about it. We're in this lab for long periods a day, and everybody called us the Voodoo Lounge. That was what they termed us, Cath Lab people. The Cath Lab people that we worked with, they said, what are you guys doing in there in the Voodoo Lounge? Everybody thinks it's this like mysterious, what are they doing in there? Why are they in there for so long? What's going on? What are they doing? The Cath Lab is plumbing, and EP lab are electricians. So if you have a blockage in your pipe at home, then you get a plumber. Mm-hmm. They come and clear the blockage, flow restores. If you are interested in electrical things and electrical conductivity and things that are going in that area, then you need an electrician. If something's it's short-circuiting, it's doing something it's not supposed to do, or it's not doing anything at all, then you need an electrician. So basically, EP lab, we deal with anything electrical. We do ablations, fast rhythms, slow rhythms, heart rhythms that are fast and then slow, or slow then fast, or numerous things. We do implants, we do 3D mapping, later on we started doing structural things. And so basically it's a procedural area where you can do anything to correct or heal, because a lot of the things that we do ablation wise is actually curative, so we can completely heal an arrhythmia. So those are how I would describe the differences of the two. How do you get in there? If you're like me, in a place that doesn't have CVT programs, then you want to do what we call OJT, on the job training. You can enter most labs as any healthcare professional. Some are a little more vast in what they will take. If you are around places that have CVT programs, then that's your best, and I think your easiest way in. You will get a lot of that foundational knowledge that OJTs didn't get. And so my recommendation would be to go via a CVT program route.
Yeah. And if not, it would be most common would be nursing and rad tech, respiratory therapy, paramedics for some states, and sonography for some states as well. We use cardiac echo in the EP lab and the Cath lab, and sometimes people meet that way. We do work more as a team environment than majority. Even if you've been a respiratory therapist, you have health healthcare experience, it's going to demand so much more teamwork, and you're going to have to get used to working with people of different backgrounds. Pay-wise, very different now from what it was before, I hope. I hope it's improved.
Oh, yes.
Did you get, while you were on a respiratory therapist scale, so did you necessarily get paid more?
Oh, I did not get paid any more because I was in EP. Much later is when the differences started being noted.
I guess the local hospital here hired you in an EP specialist position, so they didn't pay you as a respiratory therapist because they knew a little more about what that should look like.
They knew more about it because they were in an area where there were CBT programs. They had worked clinically with students, with interns, and hired these people. So they did have that. And fun fact that you may not even know, my first day that I started at said hospital was the announcement of the clinical ladder for techs for both EP and for Cath Lab. So nurses had already had clinical ladders in this institution, but Cath and EP did not. And the very first day that I started, it was announced that the clinical ladder was being initiated. So I did go in at that exact moment. So immediately I was able to get a raise.
Right.
Because the way the ladder...
You had experience.
I had experience. I came from Tennessee and I relocated here. So immediately, as soon as they announced that, I went straight into the manager's office and I'm like, what timing? And does this mean that I am eligible to do this because I have the years of experience that qualify now for step 2? So I immediately, within my first day, got a raise, which I thought was excellent.
As it should have been. And some people, because I see in the Facebook groups, are trying to build ladders because they're like that right now, where everybody's paid in their silo of whatever their background is. And it's very hard to incentivize learning or have equal responsibility if everybody has different job descriptions, essentially, and completely different segments of pay. Because the difference between, sometimes, like when I interviewed at other places, the difference between me being paid as a rad tech, which is the only equivalent they knew to pay me as, or what I would have expected as an invasive specialist, was almost $10. And I was like, wow, that's, you need to learn what this is so that we can fix this. And here's this ladder from this place. And can we do something like this? And whether I take this job or not, like if you want people with this type of background, this is kind of what they're going to expect. If you're catering to people who have experience, they're going to come in and kind of expect that.
You can't recruit experienced people if you're not willing to
change some things.
Right.
Or ask them, hey, can you print out for me what your current job description is? Do you guys have a ladder? What does that look like? And then we'll try to
comp it, match it,
apply it,
any of those things.
What was the moment you knew this was your career path? Anything happen where you were like, I'm happy here?
After my initial drowning.
How long?
And sustaining. I remember when I started, there was a rad tech in the EP lab. And I remember thinking, if I ever know half of what she knows, I'll feel like I'm in a good place. Ended up leaving. I ended up learning what she knew, and then I ended up learning more.
Yeah.
And I think you have to know that you have to put the work in. I didn't get a formal education in invasive procedures or sterile, I knew sterile technique from respiratory because of certain suctioning types and things like that, but I didn't know procedural. I didn't know intraprocedural. Yes, I knew ACLS. Yes, I knew rhythm recognition. And yes, I knew intubation and, 12 lead EKG. But let me tell you, when you're looking at the screen in the EP, I'm like, why is it so wide? Why does it look funky? Why is it weird? Why is it so stretched out? What is wrong with this person?
You know AFib, but not when it looks like that.
It's different than seeing it on the monitor in the unit or on the 12 lead printout, because they're looking in EP. We're looking at sweep speeds of 100, 200, 300, 400, because we're breaking down and dissecting every single beat versus what you see on the screen. So it looks wildly different. I also didn't know yes, I knew ACLS rhythms, but I didn't know there's right-sided left atrial flutter and there's left-sided atrial flutter. And atrial flutter could be coming from anywhere. And I'm like, what? In ACLS, it's just a flutter. Like, we go down the algorithm and this is that, and, we
and
shock
it treats
or don't
it, right?
shock. And I'm like, And so my eyes were really open. I'm like, wow, there is so much. There is so much in this. And that was the thing. I kept learning and I kept learning, and there was more for me to learn. And then I kept learning and I kept learning, and there was more for me to learn. And I realized this is where I need to be, because I do get bored really easy. I learn things, and when I was young, I was 23 when I started in respiratory, and when I started in EP, I was 25 or 26. So I was a sponge, and I had a great memory, and I just sucked it all in. And so I realized this is an ever-changing field, and I can see myself here for a long period of time versus, once again, not knocking respiratory, but versus what I had experienced there.
Well, it wasn't what you need to feel satisfied in your job. Some people have so much going on at home or in their personal life, they can't take that stimulus at work. They need it to be predictable, clock in, clock out, kind of low stakes, chill, when they get to a point where they've learned everything, that it is muscle memory, and they don't want any more than that.
And I think that's a true statement, because I was young and I was married, but I didn't have any kids. And so I could put that time in. I worked. And one of the requirements, I will tell you, at my facility where I entered into EP, it was required during orientation. You worked all day, every day, Monday through Friday, from the time the cases started until the time the cases were finished, while you were on orientation, because they didn't want you to miss anything. And of course, the more that you were exposed to, the faster you would learn. And so I got that, and I was able to do that. And I can tell you, that primary EP that I discussed, who I later worked with for 6 years and loved, and he was fantastic. He worked us to death. 6:30 a.m. I remember eating dinner in the break room that he would buy. He would buy us dinner because he felt obligated to, because it was past dinner time.
We're here because of you.
And we were still working on his patients. And I was eating food, watching The Tonight Show in the break room, which is 11 p.m.
Yeah.
And I worked, I worked, but I have a work ethic, and I was hungry for the change. I was going to prove myself that I did say, I'm up for the challenge, so you better show that you are up for the challenge. And I also knew I was not going back. So I was like, I've got to dive in. And I did. I knew it was for me when I saw how much there was and how it could be ever changing, and then I could never get bored.
And that's what you were looking for initially. But I want to acknowledge it, because I think you have a unique form of letters after your name.
Unique.
You have a few credentials and degrees. Tell me why you got them.
I didn't start out with that plan.
It's an expensive plan when you're young, It
is, but I didn't start out that way. I came from a single mom. She basically forced me to go to college because of the choices that she had made in her life that did not put her where she thought she would be. She was a stay-at-home mom. She ended up divorced with no high school diploma or college education. And I remember it being completely ingrained into my head from the time I was 9. You will go to college. You will get a degree. You will be able to sustain yourself, and you'll never need to rely on anybody to take care of you, because you're going to be able to take care of yourself. And I saw her struggles. She's an amazing woman, but she ended up getting her GED. She ended up going to college and getting some college, and she ended up getting a better paying job. And she worked herself through that over the years, and we survived. And she said at one point, if you don't go to college, I will make you go, and I will go with you. And I thought,
something
and as a teenager, you're like,
Absolutely not.
Mom, you are not going to class with me. So I knew that was part of the cards for me,
Yeah.
whether I wanted it or not. And I never really denied saying that I wanted an education. I knew I did. However, I never knew what I wanted to do.
Yeah.
I never had that. There are those people. My husband was one of them. I want to do this, and I didn't have that. I was in college, roaming around, taking courses, having not a clue what I wanted to do.
Inspiration.
And I just knew I was very good at science, and I took all of those science courses, and so that's actually how I ended up in respiratory. Is that I got a letter and it said, we would love to see you apply for some of our allied health programs.
You look confused. Here are some path options.
Yes, and that's basically what happened. They're like, you're taking all of these courses and they fit a lot of our curriculum.
I mean, that's really nice of them to do.
And we would like to invite you to apply to some of our allied health programs. And I thought, okay.
What a great school strategy.
Yeah.
Like, somebody
and that was
needs
a long
to
time
learn
ago. That was in the early 90s.
But if you need seats, that's a great way to find people.
This is what they did. And so I can tell you, my husband knew he was doing medical. And I had a friend that had actually applied to respiratory therapy program the year prior and didn't get in.
Oh, gosh.
And I thought, well, what am I going to apply? And I'm not going to get in.
Right.
I'm not going to get in because I know somebody and he didn't get in last year and he applied and he on purpose was applying. And so I applied to respiratory therapy and I laughed it off. I was like, okay, well, I'm going on vacation. So I went on vacation with some friends. I came back and I had a letter because, back then that's what we did. We got letters in the mail.
When you get the big thing,
you get letters in the mail, right? And so I was like, oh, they want me to come for an interview? Okay, well, I'll go for the interview, but it's not like I'm going to get in. They only take 14 people, and my friend didn't get in last year, so, but yeah, I'll go. It'll be a good experience. So I went into the interview. I left. I was not nervous. I just did my thing.
Because you didn't really want it.
And this is so crazy. It's true. So I left and I was like, thank you. I had all my manners and I did all the right things. Then I left. And then I was working in a hospital at the time. And I was a switchboard operator. And my mom worked in that same hospital. And the package came in the mail. She brought it to me at work. Now remember, this is the mom that said you're going to do the, So she interrupts me at work and comes knocking on the door. And she's like, I got your package. She's through the door. Package. And I'm like, what are you doing? So
quit embarrassing me.
I literally was on the job answering all this incoming calls of the switchboard. And she's like, you have to open it while I'm here. I'm like, oh my goodness. So I opened it and I got in. 14 seats and I got in.
So did you want to accept or did she make you accept? Because showing up is a completely different thing.
So I don't remember. I remember everything. I always thought everything happens for a reason. I've always believed that.
Divine intervention of this.
I've always believed that. And so I thought, okay, well, I guess I'm going to do this. So I don't know that I was like, no, I don't want to do it. But gosh, I mean, she's right here and she's watching me open this package. How can I say no?
You're going, right?
Right. So
I'm coming with you.
I don't remember being like, I don't want to do this, but I kind of felt like, well, this was meant to be because they sought me out. I didn't. And so I ended up accepting, and the friend that I knew that had applied the year before got in too.
Oh, okay.
We were in the same.
I'm glad that worked out.
It did, because I would have felt really bad.
Yeah.
I'm like, I didn't even want to get in, and so it
well,
worked
at that
out.
age too, some people are afraid to accept those things when they saw that opportunity didn't come for someone else, and look how much that would have changed the trajectory of your life if you prioritize that person's feelings kind of for your own,
and that's
what you wanted.
And that's the point that I make to say that I wasn't bashing respiratory therapy ever. That was the one decision that changed my entire career.
Yeah.
My entire future was that one decision. And so I don't knock respiratory therapy for that, because it got me where I am. Because it's even like when we were teaching in a program, we would tell students, you just need this one degree. You need this one credential, and then all these other doors are going to open. And I knew that because it happened for me. And I was confident in telling them those things because it happened for me. And so, yeah,
and
that
I've seen it
could have
happen for so many
changed.
people who do completely different things now.
And you'll end up in places you never thought you would end up. My whole career trajectory, if you had told me any of it, I would have laughed you off the planet.
It's rare unless they have a personal experience or they currently work in like the office of a cardiologist or electrophysiologist that someone says at that age, I want to work in the Cath Lab, I want to work in the EP Lab. I mean, I think out of all the students we've taught, there's only 2 who like actually knew what it was because they worked in an office or had a personal experience.
Or some of mine, before you came as a student and then later to work with me, a lot of them knew they wanted to do it because they had procedures themselves. For the people that knew.
Yeah.
And so, yeah, I didn't know what I wanted to do. And if you ask my husband today, and I'm almost 50, he would say, Shawna still doesn't know what she wants to do. And it's true. It was my entry into healthcare. I graduated with my AS in respiratory care. And I worked in respiratory and said, I don't want to do this forever. Googled and found my way into the EP Lab. Got hired there. Even when I was in the EP Lab, I was so busy learning everything. Future education wasn't on my mind.
Oh, you didn't have time.
So I didn't have time.
Yeah.
I was trying to learn so much and I was doing charge. I was a charge person too, and I was ordering supplies. And that's the thing. When you do something and you do it well, then you get to do all these other things. And it looked like I was just this really great, smart person. In all reality, I just paid attention and I memorized what he did because he never faltered from it, ever. Yeah. And so because I could anticipate all those things that he always wanted, he adored me. Yeah. Taught me a lot, and because he knew I was truly interested. And so I was deep in. So I didn't have any future education on my radar. There was not an RCES back then.
Yeah, that's newer.
So
there's only like 2,500 credential holders, I think.
Oh, really?
Mm-hmm. That's the 2024 stats.
Oh, okay. Yeah, there wasn't an RCES then. I'll also tell you, I did get pregnant while I was in the EP Lab. So I did, yes, I worked in radiation while I was pregnant, and that was all fine. Everybody says that my son has red hair because I worked in radiation. So that was like a big joke, but he loves electrical things and always has. And so we think that might have, contributed. But then I had a brand new baby too.
Yeah.
And so I was running that lab and I was still learning, and things were changing quickly. We got a stereotaxis and I had to learn that, and I was learning 3D mapping, and I was training all these people to monitor and do pacing protocols and do his dictation reports and all this stuff because I didn't scrub while I was pregnant. And so
there's plenty more for you to do.
I had so much stuff on my plate, and then I had a newborn baby. And so education was the furthest thing from my mind. When we relocated to Florida in 2009, I got hired at a local hospital as staff and dedicated EP again. And they kept saying, oh, this, they were just enamored. Oh, and they would take me around and introduce me to all the doctors, and everybody was like, oh, this is Shawna. She's from Tennessee, and she has over 6 years of experience in EP Lab. And I was like, will you please stop telling people that? Because I had experience, but I had experience in one place with a few physicians, and everybody knows.
Everybody does everything different.
All these EP docs do everything different, which is why on the channel, I'm like, you might see this, you might see that, you might see it this way, you might not do it this way. So varied and so different. And I just didn't want to be the new girl coming in and everybody having these high expectations, like, oh, she has all this experience. And then they do something a way I've never seen it done, which happened. And then I'm like, I thought you said that you had 6 years of experience. Like, then I look stupid. And I'm like, please stop saying that.
Because some people have also only worked at that lab and don't know it's done differently in different places.
And I learned some different things. Now, did I teach them some things? I sure did, but I was very careful about how I approached that, because you don't want to come rolling in
where I came from,
because that's not what you want to do. And well, the way we always did it was this, I was very observant, and I stood back and I watched everybody, but I saw people struggling monitoring, and I saw people struggling with pacing protocols, and I was like, you know, I could give you a pointer if you would like. And they'd be like, sure. And the keyboard shortcuts, they weren't using. Why are you guys not using that? Like, but our guy worked fast and he was super skilled, and so I mean, we had to keep up. And there's no way I could have clicked and did the drop down box for every single refractory period every single time.
Yeah.
And when I showed them that, they were like, what is this, and why has nobody told us? You know, but there were things
if
that
you didn't get the training or think to ask the question, and you're based on whoever trained you.
And who was your rep? That's what
that might have been their first day.
Right.
You know? I know I'm
know.
supposed to teach them this.
I just know that this is how we did it, and it's super quick,
Yeah.
it's efficient, it's so much faster than a drop down box. And so I taught them some things, and then they had to teach me some things, because there were 10 EPs where I started.
Yeah.
And now remember, I worked with one primary and then 2 other that could, you know, occasionally get in. Now there's 10.
And they're all very, very different.
They were all very different. One of them, I was like, what are we doing? Somebody help me. He was doing things I had never seen before, and so I mean, that was a learning curve, so they had to show me how he did it this way. There was a give and take. There was a lot of that. On that clinical ladder, there was a step 3.
Oh, yeah, they used to do that by degree, didn't they? Well, bachelors qualified you for higher.
Bachelors qualified you for a 3, and RCES qualified you for a 3. Well, RCES had just come out, so I thought, I can do that. I can do that, and get my bachelor's too while I'm at it. When I graduated my AS, I was like, oh, I'll come back, and if I ever do my bachelor's, I'll do it in like 2 or 3 years, and if not, then I just won't worry about it. Well, eat your words, because it was on the clinical ladder. So I did the RCES first. I applied for the exam. I didn't tell anybody.
A lot of life-changing things happen while you're on the clock, I've noticed.
Oh, yeah. I mean, everything should be while you're getting paid, right? Don't do anything off the clock. So I was like, okay, I applied. I didn't tell anybody, because number one, I am
that hasn't
horrible.
really changed.
I am a horrible test taker. Like standardized test taker, I can do anything. You can show me, I can do it. Please don't ask me to sit down and take a standardized test. I failed my respiratory board the first time.
I didn't know that.
I had to take the ACT in high school. Now, I graduated with honors.
I did bad on that.
I graduated with honors. I never studied. Even in respiratory school, I never bought the books because I didn't read them. I just needed to go to class and listen. And then I needed to go to lab and clinical to do, and I got it. I don't need to read a book. And if you know these college books, they're horrible. Like nobody wants to read them. They're boring. They're over your head. And I was like,
sometimes you're not tested on it anyway.
And so. I'm not going to pay for these things. I can't afford it because I was paying for my own school. My mom couldn't afford it.
Yeah.
And I was like, I can't waste $400, $600 on books. I just don't have it. And so that's how I learned, though. I was auditory and hands-on. That's what I had to do. So I was like, you can show me, but please don't make me take this test. So I did. I took my respiratory board twice. I had to take it twice. And I passed the second time. Hallelujah. Or I wouldn't be here today. So there was a registry. All right. So there's the CRT, the Certified Respiratory Therapist. I went to a registry eligible program. I was already in EP. And I was like, why should I even bother? That RRT is not going to affect my job.
Yeah. Well, and you knew you weren't going back.
And I knew I wasn't going back. And so I was like, I don't want to pay them $400 for something that doesn't even matter. A lot of people, that was probably the number one question people ask me. Do you ever regret not taking your RRT because you were registry eligible? And people would even say, but, because my husband is a respiratory therapist there, and even my faculty in the program, because I was like, I don't even care if I have it, and they're like, but why would you not want it? Faculty doing the faculty thing. And I'm like, because to me, some things I just don't care about.
Yeah.
I just didn't care about that. It wasn't important, and I had already moved into EP. So I was like, In Tennessee, I had to have that license to work in the lab. Yeah. So even though I wasn't doing respiratory therapy anymore, I had to have the license because they had to have something on you. Still, and have always kept my license current for numerous reasons. So the RCES I scheduled.
Yes.
So when I got my thing, I scheduled it from work. And I'm like, what do you have available? Because, you couldn't do the computer thing then. You had to call. What do you have available? And my son was in school. And so I'm like, I have to do this while he's at school because we don't have family here.
Yeah.
It's just, the two of us. So he has to be at school. And they're like, we can do Wednesday at 10 a.m. or whatever.
Like the next week?
Yeah, it was Monday.
Oh.
And I said, okay. I said, I'll take that. It was like Wednesday at 10 a.m. I told no one. The only person who knew I was going to take that exam that day was my husband. And I went in and I took it and I passed. And
that worked out. I can't believe you took it 48 hours later.
That was the first time I've ever passed any kind of standardized test, because remember I said I had to take the ACT twice just to get into a community college. It was I'm horrible. So I came out and I had passed that RCES in 2 days.
Yeah.
But I had worked in EP for a long time. Yeah. I don't recommend that you do that. If you haven't worked in EP for a long time, don't schedule your test in 2 days. But I did. But I felt confident. I felt confident that I could do it, and that it was the time I needed, and I did it.
Well, I always say the worst thing that happens is you don't, and you got to take it again. You're out money.
And I didn't tell anybody for that reason. So I passed, and I remember going to the car, and I let him know that I passed because he also knew my whole thing with standardized test taking. And I couldn't believe it. I was like, this is the first standardized board type thing that I've ever passed. And at that moment, that is when I knew, I really know this.
Yeah.
I really know this stuff. I knew I did before, but I think you and I have talked about this before. I think every successful person deals with imposter syndrome somewhere along the way, if not the whole way through. And I thought, I have trained literally hundreds of people, and now I'm here, and now I'm working in a new place. But I know this stuff.
It is nice to be validated sometimes.
Yeah. And so I went to work, and I said, I just passed my RCES. And the whole department was like in a frenzy. So
when did you decide this?
When did you take this? When did you take this? I was like,
Monday.
I scheduled it on Monday, and I took it on Wednesday, and I went in and I took my paper on Thursday, and they announced it, of course, which was embarrassing. They announced it at our staff meeting, and I was the first person in that EP lab.
Oh, really?
The first person to take the RCES. So that kind of then sparked
should we all get this?
Yeah. Now that she's done it, are they going to expect all of us to do it? That was the first question. Now that you did that, they're going to expect all of us to do that. And I'm like, well, that's on you. But I knew I wanted it because I saw it on the ladder. And I'm like, if they're going to pay me more money for it, I have the experience. Why shouldn't I go take it?
Yeah.
And so I did. And to me, that was way more important than the RRT ever was to me.
Yeah.
And
it was relevant.
It was relevant for what I was doing, and it was really important to me. And I thought, I can do this, so I did. And then they were like, oh, well, if she can do it then, and then it kind of changed. Oh, well, if she can do it, then so can we. So people, started to say, okay, I'm going to study. I'm going to do this. I'm going to do this. Though, I think there was only one person while I was still there that ended up going to take it.
Okay, I was going to ask you if anyone didn't pass. Because, I think people are shocked to hear that. I know people, there was the one person who reached out to me with 20 years of experience who didn't pass the RCIS, just because sometimes what you see is nowhere near the textbook way of doing things. And especially EP is so DIY. I know they don't really ask that level of stuff, but it can be very difficult for someone if you don't actually really understand what you're doing. Like, you could be great, but anybody asks you a question kind of off of the everyday that you do, and you're like, I don't really know, because I'm not really sure why we do this, but I'm very good at doing it. But I'm not really sure why.
Or maybe it was done a completely different way, but you can't think and rationalize through the process in a reverse order to try to deduce which answer you're going to pick, then you're probably going to pick the wrong one.
Right. There's a different level of experience and conceptual understanding. And I think your first lab really helped you conceptually understand what you were doing, so that even when you went to a completely different lab, you could adapt very quickly.
I did. And a lot of that was based on that primary EP that poured into me. But let me just tell you, I drove him crazy. I was like, explain this to me. Okay, do this. And then there was a point where the thing that I struggled with the most, because we did a lot of VT ablations. We did a lot of VT ablations. Actually, we were a clinical site for Thermocool before Thermocool ever became a thing. And we had to do so many, and they had to have so many VTs. And so we did tons of PVCs. We did tons of VT. And that was a mental block for me, not doing the mapping and all that, but morphology. He would be like, what axis is this? And I'd be like, oh my God, I don't know. I would just block every time. And I'd be like, this VT is RRI or whatever. And he'd be like, no. And I'd be like, oh, you know, stop asking me this. And so he made me sit down every case. And he wouldn't tell me. He was like, what is it? What's the axis of the VT? And I finally got it. Finally. I learned so much.
Well, because he knew making you better would make the whole team
better.
The
whole team better. And doctors, so many people are afraid. They're just people.
Yeah, and they want to do a good job.
And they want people to love what they do, and they want people to understand what they're doing, and they appreciate when people do.
Yeah.
And
like, that's, you care about what's going on.
And that's what that was the relationship that we had. And when I left, it was very sad. Even to this day, I have told him, like, I would not be where I am had I not been taught, you know, the stuff.
Well, it's literally like having a one-on-one instructor. As long as you have someone willing, and not all physicians can teach, but a physician who is willing to learn how to articulate and teach somebody, because they could have all this knowledge and not be able to give that to you or walk you through it. But also you're challenging him to learn how to walk you through it. Of actually, I didn't understand that. Can you show me a different way, or can we do another case? Just because you did it one time doesn't mean I got it.
Yeah, all the other things I could pick up really quickly. There was a mental block on that, and I just don't know what, but he made me sit down and he made me do it every single time.
Something.
Yeah, we all do. I credit a lot of that to passing that test, but I had tons of experience, so I don't recommend taking your test in 2 days. Of course, when I did that, then I'm like, well, the Bachelors decided, okay, well, now I did the RCES, and I got a real big pump off of that.
Yeah.
Hey, I'm invincible. I can do whatever. So I'm like, I'm going to go after this Bachelor's thing. So remind you, we were here in Florida, and I'm a respiratory therapist. UCF had a bachelor's program for respiratory therapy. It was cardiopulmonary, but it was for respiratory therapists. Oh, well, let me just check that out. So I made a phone call, and they're like, oh, well, you would need to take this and this, like some AA.
Florida.
So Florida makes you do this AA Gordon Rule thing. And I'm like, well, that's stupid. So you want me to go take and pay for these courses?
Like 10
that's
of them.
An AA before I get a BS. That doesn't make any sense. But anyway, it didn't matter, because that was the last year UCF did their cardiopulmonary program.
Moved over. Yeah.
So they sunsetted that program. So I'm like, well, of course, now I want to do my bachelor's. And now there's not one here. So guess what? I had to get online. Guess who has a bachelor's completion program in cardiopulmonary? Tennessee. So now I'm in Florida.
Yep.
I lived in Tennessee for 32 years or something. Now I'm in Florida, and now I need a bachelor's. And so now I'm going to pay out-of-state tuition. But it was still the quickest way, because it was a cardiopulmonary program at East Tennessee State University. And fortunately for me, you didn't have to be an RRT, you just had to be an RT. So I applied immediately, started the program, and I completed my bachelor's in 4 semesters.
Because they don't require all the general education stuff.
They don't. No. So I could do that even if UCF had still had that program. I could have completed this one faster because I didn't have to take all this AA stuff. So I ended up doing that, working full time. I was a supervisor at that time. So I was a supervisor of the EP lab, overseeing 4 labs, 10 EP physicians, and 35 staff members, with a small child in 1st, 2nd grade, and a husband. And I did that on top of that. I got my bachelor's, but of course, again, to the day late dollar short. That would have put me in a level 3, so I would have got another raise. However, I took the supervisor position 6 months before I finished my bachelor's. And therefore, when I finished my bachelor's, I was not eligible for the ladder anymore because I was in management pay. And because a bachelor's was not required for the supervisor position at that time, then when I asked for my raise in lieu of the clinical ladder, they said no. Right? Do you not want your staff to be more educated, to be more credentialed, to be more?
You already did it. There was no incentive.
Exactly.
Unless you're
So I
quit.
missed. So I started it because of the ladder,
Yeah.
and then I ended up going into the supervisor position, and I didn't finish it before. Now I ended up getting my bachelor's more than 10 years after my associates.
And that's, I mean, really something I wish I had known when I was going to UCF, because you don't know what's available to you. I truly didn't understand that it was an option if I wanted to get a degree in a different state online. I didn't realize it was an option. I didn't have to do the Gordon Rule stuff if I want. You have to pay more, but the thing is, if you don't have tuition assistance and you really map it out, it might be cheaper.
It was probably not cheaper in the long run, but it took less time. So to me, time is money.
Yeah.
And
if it's your path to
and
some
I
sort of
did
job
get some minimal, but I got some tuition reimbursement because that was very different back then too. But I did get some tuition reimbursement, but obviously it wasn't enough.
People who don't know, depends on the advisor. 90% of advisors are going to follow the flow sheet of the college that they're working for and tell you the options that are there. They don't want you to leave. You know, it's just like a hospital wanting to keep you at that hospital, not you go to a competitor because they can offer you something different. So it's your job to do that research and be like, oh, actually, I can go do this over here, or these courses transfer over here. They're not going to do that work for you unless it's just a really good person who wants you to be successful regardless of where that's at. But that's kind of rare. From an advisor standpoint, usually your faculty went to different colleges, so you should ask them, you know, where did you go? What did you do? What degrees do you have? And ask their path to get there, because otherwise you wouldn't really know, and no one's going to hold your hand and help you figure it out. You just kind of were like, I don't accept this. I'm going to find a different option, because you didn't have a mom who knew either.
No.
So you're just kind of figuring it out. You got a master's not that long ago.
Yes.
Why did you do that? Because I remember at one time you telling me not to get one.
Oh, yes. So I left the hospital. I left leadership. I had had enough. I had enough of seeing the business model of healthcare and how much it had changed from being patient-centered focus when I started, and then just becoming more and more business, and we don't care about staff. We don't care about the staff's mental state. We don't care about burnout. They were bringing in consultants and saying, what can we cut? And we're going to cut 5 positions. And I was the supervisor, and I looked at them and I said, you don't even know what we do. You have no clinical experience. There's no way I can run 4 labs safely with people who are competent in these roles. Cutting 5 staff members, that's a team and a half. That's almost 2 full teams. But yet you still want me to run 4 labs
At
safely
the same capacity.
at the same. No. Consider this. I'm one of your 5.
Yeah.
I will not do this. It's not safe. I can't, and I won't. And so I was like, I'm done here. So that was why I exited the hospital. There I ended up in education, which many people had told me about the position of the CVT program that was available, which I knew about. And I had even talked to the previous dean, because at one point they were not going to continue that program. And I said, no, we hire them. We use them, you know, as interns, and then we hire them full time. We need this program. And little did I know at that time that I would be one of the people that she would later hire. I had no idea.
It wasn't on your radar.
It was not on my radar. Once again, nothing's ever on my radar, because I don't know what I want to do with my life. That position, people kept saying, why don't you apply? And I kept looking at people like they had 3 heads, and I'm like, it's a Cath Lab program. I've never done Cath Lab. Why are people asking me to apply to this job? I've never been in the Cath Lab. EP is all I've ever done. I talked to my husband and I talked to my mom about it, and they both were like, I don't see why there's a problem. And I'm like, well, I'm glad that you guys don't, but I've never done this before.
Yeah.
I've never.
Well, you're someone you want to know.
Because once again, I don't want to look stupid. That's I'm not going to go in anywhere looking like I don't know what I'm doing. The more time that went on and the more people that ask, I thought, once again, I'll apply. But this is not gonna go anywhere.
Yeah.
So I applied. It was a lengthy process. I was interviewed and I was hired. Commenced drowning once more. Now this, if you consider it, so I went from respiratory therapist into EP, I went from EP into leadership, and then I went from leadership into education. I have pivoted multiple times.
Yeah.
Multiple times.
You know, you could have adapted to being a business-centric health admin leader instead of a patient-centric, staff-centric leader, and you chose not to. Because that is a pivot. That's a complete, to ask a healthcare professional who actually cares about patient care to pivot into something like that, you do have to compromise and change who you are and say, this is the type of leader I have to be now, and choose not to do that. Pivot towards something else that you feel's adding, not taking away from your energy.
Any allied health faculty member, we were trained clinicians. We weren't trained educators. And so training somebody, and I had precepted hundreds, literally by this point, hundreds of people, it's not the same.
Yeah.
It is not the same teaching somebody who's already a healthcare professional how to do a job as a student who knows absolutely zero on day one about anything. They've had A&P, they've had physics, they've had math, blah, 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 but zero. That was a challenge. The lingo was the language. I'm like, what are we talking about? What are these acronyms? I have no idea what any of this education talk, academia talk is. I'm like, what are we talking about? I don't know.
Does this matter? Is this important?
It was overwhelming.
Yeah.
And I found myself in a place once again, I don't know anything that's happening here. Like, I know my field and I know what I'm doing, but I have no idea what you guys are talking about. I have no idea what your needs assessments and PLOs and flows and SLOs and the triangle and like what? It was a struggle. And once again, I knew, all right, you figure this out, okay? Or you got to go back to the hospital, which you said you don't want to do.
Yeah.
So what's it going to be? And I had to dig my heels in and figure this out. And I went through that 10-year process, a 5-year process. The first 3 years, I drowned. I literally drowned. And I still, to this day, apologize to my first graduating CBT class. I see them out and they're successful, and I'm like, thank God. Thank God you're successful, because it was not because of me at all. I had to go into that space knowing nothing about Cath, and I had to learn everything about Cath. So not only do I not know how to teach, I had to learn how to teach and learn the lingo and learn the 10-year process and learn all of that while I'm learning the 100% course content of a CBT program in a Cath program that I have never done before. I've never done that. Massive overwhelm.
Well, it's like there are some people who've been 6 months on the job and are somebody's preceptor. It's like, we're learning together. And that's kind of what you have
that
to
was
do.
That was several years. And so you entered in that space.
Yeah.
You started in 2014 because you graduated in 2016. So you were literally in my drowning phase.
I didn't know. Because the thing is, and this is how anybody who's like scared to teach for the first time, you want to do well, of course, but even if you feel like you don't know anything, you do know more than the people coming in. Like, you have value to add, and you constantly, even when I first taught, there was a lot I quite literally just brain dumped. And I was like, I'm never going to have to actually know this. Like, imagine if you had to teach physics. You only have so much room in your brain, and things have to go for other things to fill. And I was like, I will never have to talk about cardiomyopathies again. Forget it. And then you have to teach it. And I'm honest with them. And I'm like, look, I learned this in school. I had to re-review it to be able to teach you. And if they ask me higher level questions, I will email it to me. I will answer you, but I almost need to read it, and you're going to still understand it quicker and know how to be able to teach and deliver it to them than them trying to read it themselves. So you still have value to add. It's just, you're going to have to take a minute and be like, I need to go, number one, read it and understand it for myself, to then explain it in a level that I know you're at, to explain it to you. But you don't know absolutely nothing. You know how to adapt. You know how to learn something new. So at least you had those skills. But it's, delivering it and then hoping it's as accurate as possible and the resources that you're using are accurate, because then they're going to repeat exactly what you said to them when someone asks them. They'll be like, where did you learn that?
And that was my biggest fear. That was my biggest fear. I'm like, they're going to go out to clinical and they're going to be like, who told you that? And they're going to be like, Professor Shawna.
Yeah.
But yeah, I every single day would say, you don't have to know everything, Shawna. You be honest.
No.
And you tell them, I need to look it up, or I'll get back with you, or whatever. And I had to do that more times than I could count. But I did constantly pep talk myself and say, regardless, you have experience. You have life experience. You have procedural experience. You have all this experience that they don't have. So don't feel like, you're not supposed to be here.
Yeah.
Because there were many times I felt like I am not supposed to be here, but this was my path, and for whatever reason, this is how I got here. I figured it out, and I got better and better and better. I'm not the best educator, don't claim to be, never claimed to be, but I figured it out. Why did I get my master's? I said I would never.
Yeah, you did.
I said I would never, and I said that I didn't see the value in it for where I was, because I'm very practical. So for me at the college, I had to have a bachelor's to teach, but I didn't have to have a master's because I had my credentials and my experience. Me, to pay that money for a master's, I wasn't going to get the benefit of that back for what it costs for what they would give you in a raise. Because I'm like, I'm not planning on working that long, so I'm not going to see that money back. And I need a return on my investment. And so I'm like, no, I'm not going to do that. By that point, you were now my full-time colleague. So you graduated, and then you were an adjunct with me, and you left, and then I was sad. You came back, and then you adjuncted again, and then you did the temp contract, and then you did the full-time. So I've
been used and abused by the academic system.
Yeah. So then you were there, and we were full-time colleagues, and you were like, I'm going to do my MBA, because you knew that you always, at this point, you hadn't started your business.
No, I just wanted, my whole goal for that, actually I wanted to do education and industry. And not that I needed a master's, but at a certain level of anything, even when you were a leader in the hospital, there's so much going on, and so many other people care about different things and numbers and budget and all of this. And I just couldn't even appreciate the conversation because I didn't know what we were even talking about. Like I couldn't possibly understand what a VP of Medtronic would want from me, because I don't understand their responsibilities and their education. And you don't have to know all of it, but I wanted to at least know what I didn't know. And that was why I wanted to have it, to understand what the conversation was, so I knew how to leverage out and delegate what I didn't know, knew what value I could bring to marketing that they were doing. And that's why I did it, to really figure out what I didn't know. Not necessarily for me to master it and learn it. I mean, everybody knows I got a 33 on my accounting final, but I passed the class. But I hired a CPA, and I respect so much of what she does because I know how horrible I am at it, but how important it is at the same time. And that's why I did it.
You were not doing this business at that time.
It wasn't even on the radar.
But you knew in your heart of hearts that you wanted that MBA and you wanted to learn those things.
I wanted opportunity.
And you asked me to do that program with you. And I was like, I don't think so.
As a healthcare person, even my manager at the time, like I go around and ask, like, what degrees do you have? Why did you choose not to do this? Because I don't know what other opportunities are there for me. And I didn't want to pin myself. I mean, you're in education, that's a different segue, but I didn't want to pin myself into healthcare because I knew I did love helping people, but I saw the business of it. And I was like, either I need to be a CEO of a hospital to implement change. I always wanted to put myself in a position to change the situation. Leadership just never, we had a great manager. That was never an opportunity on the board where I was. I was like, okay, where else can I go and change something? And academics was one, but there was value at the time. The college didn't really pay for much of it, a little bit, but not that much.
It was minimal.
Yeah. I mean, there were way more expensive programs locally, but I didn't, that was the thing was if an MBA can be up to $100,000. That I never saw return on my investment on. But if I could find one that was relatively affordable, I could see that long term.
Any compensation to where I would get my money back, because I had 20 years of experience. So my salary was good.
Yeah.
I felt very comfortable with what they were paying me. But the small amount, and it was small, $3,000 a year. I mean, how long do I have to stay here? Right. How long do I have to stay here to get that back? So for me, I knew that it wasn't necessary, but I also knew I didn't need my bachelor's when I got it either. But then in the future, when I applied for that educator position, I had to have it, but I already had it.
That wasn't the purpose of it.
And that wasn't the purpose of it, because I had no idea I was going into academia at that time, but I ended up having it. And once again, everything happens for reasons. So I'm like, okay, I don't want to do MBA, but what if I did find something that I would want to do? So when I looked and I found Florida State's Juris Master, and they had a concentration of healthcare regulation. Listened to their information session, and as soon as I got off of it, I was like, that is exactly, if I'm going to do anything, that's exactly what I'm going to do. Because I'll get the raise now when I finish, but I don't know what is going to be in my future. And I always feel like if something is presented, then you might need it later.
That's how your life has worked out.
That's been my whole journey over these 25 years. There was never a mapped out road. It was, okay, I just go down the road, and then now there's a fork this way, so I went that way, and now there's a fork this way, and I went that way. I did it, and I loved it. It was definitely where my passion lies. And I learned a lot from it, and boy, was the timing ever great, because it was during COVID. And I learned a lot. I knew that healthcare fraud was going on during COVID. Healthcare fraud's been going on for a long time. It was great. I thoroughly enjoyed it. I did get a little bit of help from the college. Glad that I did it, and I still don't know what I may use it for in the future. But I did go ahead and I started taking some of those things and already using it in the program when I taught there, because a lot of students don't get the legal aspects or what some of the very, specifics are about HIPAA or about informed consent or, DNR status and code of ethics and who's to make this decision. Like, there's a lot of that stuff that students don't get. The timeouts and why those are so important, and prevention of medical errors, those things that they don't necessarily get education on. So I would integrate it. So I did use some of it already.
Well, there's a difference between knowing it's a thing and realizing when you're in a court case or see what can happen, how much of a difference it makes. Because it sounds like a fairy tale, like, of course none of that stuff is ever going to happen. Of course, and it not until it's reality for you. You've seen it, experienced it, get called to court, have to talk about it, that you go, oh my God, like this could happen. And this is a safety measure for that reason, because it has happened. And this was the solution to prevent these things from happening again. So yeah, it's not real until you're involved. Then it's very real.
Any of my students out there, former students, they know case studies, I would rip their logs apart, because I'm like, you cannot do this. You cannot have these omissions. You cannot have anticoagulant given, and if you use heparin, not have a therapeutic ACT on that log, because 100% your patient has a stroke post-procedure, The
That's what
first
they're
thing
gonna
they're
look
going to look at, and they're going to look at the log. If it wasn't documented, it wasn't done. The ACT, I don't care if you guys did it and it was therapeutic, but if you didn't document it, you can't prove that you did it.
Yeah.
You're writing a check.
Mm-hmm.
That case is closed. You're writing a check. Period. End of the story. Protect yourself. You've got to do things.
And you're not going to remember
Legal.
in 7 years when you're asked.
You're not going to. You don't even know
And you
what happened
can't
in the
say.
last case.
Yeah. They're going to say, you have to say, I can't recall. Because it's hard to prove that you can accurately remember that happened.
Yeah,
if you didn't document it.
You won't remember. And so it was one of my passions and still is. There's tons of medical malpractice. There's tons of medical negligence. There's tons of just mischarting. So many things. And yeah, there's a lot of lawsuits out there that shouldn't be occurring. I totally agree with that. But you know what? There's a lot out there that are completely valid.
Yeah.
And these people and their patients' families, if they don't survive, they deserve that. If stuff was,
preventable.
Right. If it was preventable, if it was reasonable, that's the thing, what is standard of care? And if we failed to provide standard of care,
people will learn this if they're ever in leadership. The only way that things change in a hospital system is when there's a financial fallout.
Oh, yes.
A process isn't going to change for patient care unless usually there was something like that escalated to a point where they were forced to do something about it.
They were forced to pay out.
Yeah.
Not just
because it costs
to do something, but
it
to
costs
pay out.
money to sit and come up with different things and to pull people out of staffing to come up with process improvements, and it's a calculated risk on their end that they're not going to do unless there's a problem.
Yeah, that's how I ended up with my Juris Master, my master's degree. Use for it later, but as soon as I finished that, the same month, I took the RCIS as an educator.
Never expected you to do.
I learned that was an option for an educator to take the exam because, of course, I'd never worked in a Cath Lab, so I was like, why would I take that exam? Found that out then, and then, like I said, COVID happened, and then everything else. So once everything settled down, and then I graduated on May 1st, I had scheduled my exam for May something, a couple of weeks later. Once again, didn't tell anybody, not even you.
You told me you were taking it, but not when.
But not when.
Yeah.
Yeah, I was not going to say that because how embarrassing would it be to be a program director? So for the first 5 years that I worked there, I was the clinical coordinator, full-time, faculty and clinical coordinator. And then the last 7 years, I was the program director. So, how would that look if somebody who has taught in a Cath program for 13 years, almost 13 years, went to take the RCIS and failed? That would be like...
It can happen.
It would not be good.
But you didn't want it to happen to you.
I can't have that stress. I can't have that stress because, once again, my standardized test-taking ability, I literally cannot do this. And I wasn't even going to be out money if I didn't, because they had a waiver for educators to take it. But I had always, from the time that she told me that on the site visit, I was like, I'm doing this because I needed, once again, not for anybody else. I needed it for me. I needed to know because there was a lot of imposter syndrome the whole time I was at the college. So I needed to know, I knew that I knew stuff and I knew I was able to teach students better year after year after year, but I was like, I need to know this for myself. Scheduled it after my graduation, and I went in and I took it, and then you were my first phone call when I
was like,
got
wait,
out.
You took what?
You're like, what? When? Now. I just got out. And you're like, what? So yeah, I didn't tell anybody because of all that, and then you were my first phone call.
Oh, that's special.
After. And so then that's when I got my RCIS. And then
still, it was like less than 30 days.
Yeah.
But I mean, you're kind of passively studying the whole time.
But I was passively studying the whole time I was teaching because I was teaching it to students. And there's no better way to learn something than to teach it. So I really felt confident that I would pass, but there's always that lingering, what if I don't? And then how embarrassing that would be to have worked as an educator in a Cath program and not be able to pass after all these years. But I did, and so there was that. As we both later left those positions,
You have it if you need it.
Yeah, I have it. And I'll keep that credential just
Not
like I
that you
keep
wanna
my
work in the Cath
RCES
Lab,
credential and my respiratory license and, the degrees you always have. And I am not, okay, on camera, I am not getting any more degrees.
Well, you don't know.
No, I'm done. There will be no
could be one
there
day.
would be no PhDs, no doctorates, no.
Yeah,
none,
I never.
None of that.
I
have
did entertain that,
zero desire.
but I just couldn't find anything I was really interested in that
And
I qualified for.
And that was truly the only reason that I decided to do the master's, is because it was exactly something that I was very passionate about. But yeah, I have zero interest.
I changed the concentration of my master's twice because I would take a class and I'm like, I can't do 10 more classes of this, and I would change to something else. I'm like, okay, this instructor's great. This is way more interesting. I can do that.